PCOS isn't just about having cysts on your ovaries. If you have been diagnosed with polycystic ovary syndrome, first thing is to check your blood sugar level and diabetes status. If you can afford a HbA1c test, do it. Otherwise, do a regular after-meal blood test. If you have diabetes or pre-diabetes, do not hesitate to ask your doctor for a prescription for metformin. It is a cheap and effective drug for pre-diabetes. In PCOS, your body produces more male hormones than usual. This can cause problems with your periods and make getting pregnant harder. Your body might also struggle to use insulin properly, which affects how you process sugar in your blood. So it has a connection to insulin resistance and diabetes. We are going to talk about 1. Common signs and symptoms. 2. Health conditions associated with PCOS. 3. Diagnosis of PCOS. 4. Treatment options for PCOS. 5. Lifestyle changes and living well with PCOS. This video has chapters, and you can skip to the chapter that suits your interest. Polycystic ovary syndrome affects millions of women worldwide, with significant impacts on both reproductive health and long-term well-being. About 13% of women in their childbearing years have PCOS, making it extremely common. But the worrying part is that up to 70% of women who have PCOS don't even know they have it. Research shows it comes from a combination of genetic factors and your environment. If your mom or sister has PCOS, you have a higher chance of developing it too. Weight can play a role as well. But women of all body types can develop PCOS. Common signs and symptoms. The signs of PCOS vary from woman to woman. Common symptoms include irregular periods or missing periods altogether. This happens to nearly 70% of women with PCOS because they're not ovulating regularly. Excess hair growth in places where women typically do not grow hair, like the face, chest, back, or belly. This affects about 70% of women with PCOS. Acne or oily skin. Around 30% of women with acne actually have PCOS. Weight gain and trouble losing weight, particularly around the middle of your body. Hair thinning or hair loss from your head. Dark patches of skin, especially in the creases of your neck, groin, or underneath your breasts. Small cysts on your ovaries, which can be seen on an ultrasound. You don't need to have all these symptoms to have PCOS. Some women have only a few, while others might have most of them. Your symptoms can also change over time. Health conditions associated with PCOS. PCOS doesn't just cause visible symptoms. It's connected to several other health conditions that can develop over time if not properly managed. Women with PCOS have a higher risk of developing type 2 diabetes. More than 50% of women with PCOS develop diabetes by age 40, which is 2 to 3 times higher than women without PCOS5. There are increased chances of heart problems too. Women with PCOS have a 68% higher risk of heart disease overall. Their risk of heart attack is 2.5 times higher, and they have a 71% higher chance of stroke. The likelihood of developing endometrial cancer is greater. The risk is 4 to 5 times higher in women with PCOS, with an estimated lifetime risk of 12 to 15%, compared to 3% in women without PCOS. Pregnancy complications are more common. Women with PCOS are 3 times more likely to develop gestational diabetes, have 3 to 4 times higher risk of preeclampsia, which causes dangerous high blood pressure during pregnancy. About 21% experience preterm delivery, compared to 12.5% of women without PCOS. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Mental health challenges affect many women with PCOS. About 20 to 40% of women with the condition experience depression, and many deal with anxiety too. Sleep problems like sleep apnea are also more common among women with PCOS. These health risks sound scary, but with proper management, you can reduce these risks significantly. Getting diagnosed with PCOS. Getting diagnosed with PCOS can sometimes be tricky. Many women go undiagnosed for years, and it often takes seeing multiple healthcare providers before getting proper answers. Studies show that diagnosis is frequently delayed, with many women seeing 3 or more health professionals and waiting over a year for a diagnosis. To diagnose PCOS, doctors typically use what's called the Rotterdam criteria. According to these guidelines, you need at least 2 out of these 3 features: irregular or absent periods, showing that you're not ovulating regularly; signs of high male hormones, either visible on your body like excess hair growth or shown in blood tests. Polycystic ovaries seen on an ultrasound, which means having 20 or more follicles in at least one ovary. But before confirming PCOS, your doctor needs to rule out other conditions that might cause similar symptoms, like thyroid problems or certain tumors. The testing process usually involves a detailed medical history and physical examination, blood tests to check your hormone levels, blood sugar, and sometimes other values, an ultrasound, usually a transvaginal one, which gives the clearest pictures of your ovaries. Sometimes additional tests are needed to rule out other conditions. Diagnosis in teenagers can be particularly challenging because irregular periods and some other PCOS symptoms are common during normal adolescent development. That's why doctors are often more cautious when diagnosing PCOS in younger women. Treatment options for PCOS. There are many effective treatments available for PCOS, but what works best depends on your specific symptoms and health goals. If you're not trying to get pregnant, hormonal birth control pills are often the first treatment suggested. They help regulate your periods, reduce male hormones, and improve symptoms like excess hair growth and acne. Different types of birth control contain different hormones, so your doctor might need to try a few before finding the one that works best for you. For women wanting to conceive, medications to help with ovulation are available. Clomiphene, Clomid, or letrozole are commonly prescribed and help your ovaries release eggs. These treatments have good success rates, with pregnancy rates of 41 to 65%, but the best results usually happen in the first 3 to 4 months of treatment. Metformin, a medication originally used for diabetes, is often prescribed for PCOS. It helps your body use insulin better and may improve ovulation, regulate periods, and help with weight management. Some women see improvements in acne and excess hair growth too. For troublesome hair growth, medications like spironolactone can help. It blocks the effects of male hormones on your skin. Studies show it's very effective for reducing unwanted hair, working well particularly for women with excess hair growth. The power of lifestyle changes. Medications aren't the only answer. Lifestyle changes play a crucial role in managing PCOS and can sometimes be enough to control symptoms, especially if you're carrying extra weight. Even modest weight loss, just 5 to 10% of your body weight, can make a big difference. Research shows that women who lost at least 10% of their body weight had an 88% chance of conceiving, compared to much lower rates with less weight loss. Weight management also helps improve hormone levels, regulate periods, and reduce long-term health risks. A healthy diet for PCOS typically includes foods with a low glycemic index, which don't cause big spikes in blood sugar, plenty of fiber from vegetables, fruits, and whole grains, lean proteins like chicken, fish, and plant-based options, healthy fats from sources like olive oil, avocados, and nuts, limited refined carbohydrates and sugary foods. Regular physical activity is just as important as diet. Aim for about 30 minutes of moderate exercise most days of the week. This doesn't have to mean intense workouts. Walking, swimming, cycling, or any activity you enjoy can help. A combination of cardio exercises and strength training seems to work best. Some women also find benefits from natural supplements. Inositol, berberine, and chromium have shown promise in research for improving insulin sensitivity and some PCOS symptoms. But always talk to your doctor before starting any supplement. Fertility and PCOS. If you have PCOS and want to have children, you should know that fertility treatments work very well for women with this condition. While PCOS is a common cause of infertility, it's also one of the most treatable. First-line treatments usually include medications like clomiphene or letrozole that help trigger ovulation. If these don't work, your doctor might suggest adding metformin or moving to more advanced treatments. For some women, assisted reproductive technologies like intrauterine insemination, IUI, or in vitro fertilization, IVF, might be needed. The good news is that women with PCOS typically respond well to these treatments, with success rates similar to or even better than women without PCOS. Research shows that with proper treatment, women with PCOS have the same birth rates as women without the condition, though they might start treatments earlier. Lifestyle changes and living well with PCOS. Living with PCOS can be challenging at times, but remember that you're not alone. Millions of women worldwide are managing this condition successfully. With the right treatment plan and lifestyle adjustments, most women with PCOS lead healthy, fulfilling lives. The key is working closely with your healthcare providers, staying consistent with your treatment plan, and being kind to yourself along the way. PCOS is a lifelong condition, but it shouldn't control your life. With proper management, its impact can be minimized, and you can focus on what matters most to you. If you think you might have PCOS, don't hesitate to talk to your doctor about your concerns. Early diagnosis and treatment can make a big difference in managing symptoms and reducing long-term health risks. Your journey with PCOS is unique, but with the right support and information, you can navigate it successfully. PCOS research continues to advance, with new treatments being developed and tested. Staying informed about these developments can help you work with your healthcare team to find the most effective approaches for your individual needs. Many women find that joining support groups, either in person or online, helps them cope with the emotional aspects of living with PCOS and provides practical tips for day-to-day management. The path to managing PCOS well might take some time and patience, but with persistent effort and the right medical support, most women find strategies that work for their bodies and their lives. Do not forget to click the like button and subscribe. On the screen, you see an essential video for you. Thanks very much for watching this video. See you in the next video. Disclaimer: consult your healthcare professional before changing your medication or lifestyle. None of the information provided by this video is a replacement for your physician's advice.